government. Thanks.
Yeah.
Great. Thank you again for the work and for your whole team. I'm going to go through several different specific areas. I want to start with disaster relief. It may be surprising to some of the folks here that Oklahoma occasionally has a random storm that comes through, a wildfire that comes across our state. So I want to get a chance to talk about this. GAO has identified multiple areas of overlap and of duplication. You also produce what I affectionately call the spaghetti map of the 30 different agencies that are all involved in a typical disaster. So if I'm an Oklahoman that lives in a small town and was just hit by a major tornado and it took out City Hall as well as taking out my house and my business, I'm supposed to figure out what agency to get to and hope they come knock on my door if they can find me to be able to tell me how to apply for assistance. I also find that the standards for assistance are different in each different agencies. The timelines for decision are different for each different agency. The timeline that it's open even to apply is different for each entity on this. So this is a hot mess as we deal with, and we just use the term FEMA on it, but this is far beyond just what's happening in DHS and in FEMA. This goes to all disaster recovery. So your recommendations are important to us. How do we start to be able to handle this? Because this quickly becomes a partisan conversation when it's really about individuals that have experienced disaster, how to get through the process. So let's talk about how can we actually better manage this process for an individual that's just gone through a major disaster?
Yeah, and it definitely needs government-wide reform. You know, we use FEMA as a shorthand for disaster assistance, so we are clearly recommending what you suggest. Chris has been following this. He's been on the ground in a lot of disasters for a while. I'll ask him to.
For each person that comes up, can you just identify your name for the record as well?
Yeah, go ahead.
Sure. Thank you. My name's Chris Curry, GAO. So usually with our graphics, we try to make them very understandable to the public. We purposefully made this one difficult to understand so people would see how challenging this area is and impossible to navigate. And as you said, this is just at the federal level. If you're a local government official, you also have to navigate state rules and requirements. Right. So we actually, 2022, we recommended that Congress establish a commission because this cuts across so many committees of jurisdiction and so many agencies, and we thought this needed to be addressed. This is 2 years before the President's FEMA Council this year. So one of the challenges in reform in this area is it cuts across agencies and committees, which makes it very difficult. And all of these programs were set up with very good intentions, but it's just one of these situations where over the years it is built into a morass of red tape and bureaucracy. It is not customer-centric, it is government-centric, and that's the main problem.
So how do you fix that at this point? So you're still, we have a FEMA process now where they're actually, the executive branch has actually said, okay, let's take a look at all this. They're making their initial recommendations. Do you still recommend a commission to be able to come on top of the previous commission?
I think we'll have to see what the results of the FEMA Council are. My concern about the FEMA Council.
Go ahead.
My concern with the FEMA Council is that it was just focused on FEMA, and so it's not looking at the other agencies. So we'll have to see. It could address some of the issues with FEMA specifically, but if it doesn't address the longer-term recovery issues that are the topic of this graphic, then a larger effort like that will still be needed. So
central for me is one application that is online, that you fill it out, give your situation, and that then it informs you of everything that you're eligible for, all the deadlines and details. To me, that's the first step to being more customer focused, as you mentioned, that rather than committee and federal focused on it, to make sure I don't have to know the secret code and the right place to be able to go. I just experienced a disaster. I can fill this out, and I'm told what I'm eligible for rather than me having to be able to guess it. Would you recommend that as well?
Absolutely. That's one of the options we suggested needs to be looked at. One single application or portal that's designed around the grantee or the customer, not around the different government requirements.
What kind of fraud do we deal with, or improper payments do we deal with around disaster recovery?
It varies across programs. Over the years, we've seen FEMA's made a number of progress in this area. Like Katrina fraud was upwards of 22%, as we all remember. Hurricane Sandy around 2012, it got better at around 6%. Since that time, it's continued to get better, but there's still fraud and abuse in these programs, particularly during COVID. There was fraud in the FEMA Funeral Assistance Program and some of the FEMA Unemployment Assistance Programs.
Okay, we'll follow up with that to get specific details. Thanks for all the ongoing work on this. I want to shift to the improper payments on the healthcare side. Gene, you had mentioned this in your testimony, the billions of dollars that are lost in improper payments. When I say improper payments to some folks here, they immediately say, well, improper payments doesn't necessarily mean it's fraud. What I get pushback on is, well, improper payments are we just don't know. So when you say improper payments, what do you mean by that?
Improper payments, the statutory definition is money that should not have been paid or was paid in the wrong amount. Right. It can include payments to ineligible people. It can include payments for services that weren't provided. It's a broader definition than fraud. Fraud is a subset of that. But every fraud, by definition, is an improper payment, but not every improper payment's fraud. Now, what the agencies would start telling you when you're in there, well, it's insufficient documentation. We
That's
can't
what I hear
tell.
most often.
And I'm like, I call foul on that. Okay, if you're IRS and you get audited by IRS, if you don't have documentation, the government will take your money.
Yep.
All right. Why should we be paying money to people if we don't have proper documentation that it's a legitimate payment? So the agencies aren't being held accountable for that issue. They're using it as a smokescreen to say there's nothing to see here. We're just making, some errors, and it's a paperwork issue.
It is an issue, as Senator Moreno was mentioning earlier, that we've got to be able to hold more people to account to say there is an expectation that we don't have improper payments that are going out the door. It's been my same issue with a lot of our contractors, that we very seldom suspend or debar contractors, and the same bad contractors do it over and over and over again, and they just get waved on it. On the healthcare side of things, because I want to be able to have some of your specialists to be able to talk through this, specifically on the Medicare, Medicaid side, and some of the other federal programs, whether it be Indian Health Services or whether it be VA, whatever it may be. What are the areas that we need to pay attention to make sure we're getting good health care options to people, but we're not actually wasting taxpayer dollars at the same time?
Yeah.
Sure. I'm Jessica Farb. I'm the Managing Director of Healthcare at GAO. So I think there's been several areas that we've pointed out over the years, especially with regard to improper payments and Medicare Advantage, making sure that CMS does everything it can to identify improving their timeliness for their risk adjustment validation audits. But this is where diagnosis codes are used to pay the providers of insurance through Medicare Advantage, and making sure that
this is the upcoding we hear about.
The upcoding you hear about a lot.
Can you describe that in greater detail so people can hear?
Sure. So when a patient gets a service, there's a diagnosis code associated with that service. In Medicare Advantage, the plans are incentivized to ensure that they collect as many diagnosis codes as possible that might be relevant to that patient's case, because they are paid based on the diagnosis codes. We use risk adjustment to pay them, and the risk adjustment takes into account the relative sickness of the patient. And so Medicare Advantage plans for many years have gone out and collected the codes. They use home health aides to go and help them make sure that they've collected all the diagnoses of the beneficiaries enrolled in their plans. That doesn't obviously happen on the fee-for-service side. But in Medicare Advantage, they are incentivized to do that. So we want to make sure that they're doing more to ensure that those are more timely. They have taken some steps this past year during this administration to do more of these.
I'm sorry, who's the they there?
CMS, the administrator and deputy administrator of CMS have been working on this and talking to us about it. We also want them to look at the diagnostic coding adjustment. There's an adjustment made to sort of account for the differences that I was talking about between fee-for-service and Medicare Advantage beneficiaries. They take the maximum. They don't take the maximum adjustment that they could be taking to sort of differentiate between fee-for-service payment and Medicare Advantage because of these incentives. So that's another area where we think they could be doing more. In terms of Medicaid, the One Big Beautiful Bill Act did do several things to address some of our recommendations there, including taking a look at redeterminations of eligibility, doing that more frequently, as well as looking at the budget neutrality of demonstrations and ensuring that those are really truly cost savings in the demonstrations. That's how they're designed. So all of this is to ensure that the programs, are running efficiently so that they can serve more beneficiaries, so that the people that really need that care can get it, and get it in a timely, effective, efficient manner. I could go on, but I'm not going to because I'm already taking up lots of your
I
time.
get it. I want to ask one more follow-up question. I'm
Sure.
going to go to Senator Marino on this, and that's on the healthcare. And I want to go to some of the testing that GAO did on the Affordable Care Act. And they did some quick evaluation to be able to say, can you get into the system and actually sign up for this and not be a person on it? My understanding is there were 24 different individuals that were fraudulent, individuals that were created to be able to test the system. The results were pretty stark on this. Yeah. So I want to be able to ask a little bit more about their report and dig in on it.
So good morning, Senator Marino, Chairman Lankford. My name is Seto Bagdoyan. I'm a director at GAO, and I'm leading the work with the testing presently. So the actual number is 20 scenarios. We started with 4 in late 2024. We rolled those over, and we added 16 more to our total. This is based on a comprehensive investigative plan. It is designed specifically to test controls, not project the extent of fraud. So I want to be very specific about that. We are focusing on the federal marketplace. And those 20 scenarios involve 10 applications through healthcare.gov and 10 through brokers, which we selected through the website itself and also through random research on Google. 14 of those are single individuals, and 14 of them they are all single. 14 of them are at no cost to the enrollee, and 6 of them do pay a modest premium. So we have been successful in 19 of 20 attempts. One attempt was later flagged by CMS in June of this year, so that scenario is no longer active. But we do have 18 of them that cost the government over $10,000 a month in premiums. We will continue to roll them over and monitor what happens from CMS.
So they're still active even at this moment?
They are, as we speak, 18 of the 20 are active.
Okay. So my question to you on this is this false Social Security numbers? Is this multiple Social Security numbers? Is this just entering Mickey Mouse and a fake address in Orlando? And, well, I guess that would be Mickey's actual address, but yeah.
Well, it would be, yes.
Right. Yeah, he vacations in California occasionally. Right. Is this a fake name and fake address?
Everything is fake, sir. All the information, driver's license, the Social Security number, pay stubs, birth certificates, anything and everything that the marketplace has asked us to submit is fake.
My understanding is there's also, you've discovered some folks that are in, or some Social Security numbers that are in there multiple times.
That's right. Yes.
So what are you finding in that where there's, this is not your test of 20 different folks?
That is actual data. That is actual data.
What are you finding with the same Social Security number being used over and over and over again?
Yeah, I will highlight the most egregious one we have to date, which is 127 policies attached to a single number. That's costing the government about $600,000 a year in subsidies. Wow. And it's a mix of full year and part year policies. And the critical point is the 33 full-year policies are spread across 13 different states, and they involve a mix of genders. So that is a red flag that something isn't quite right here.
You would think that you would notice that the same Social Security number has multiple genders and lives in multiple states.
Yes, and when we press CMS on that, Mr. Chairman, their response is we really are not going to do anything because we don't want to kick off the wrong person out of the 127 policies.
Well, that's a problem, and so we'll get a chance to be able to follow up on that as well. So, Senator Marino.
Yeah, I mean,